Hello everyone, I have a very generous patient, very interesting case I'm learning about as well. Every patient, we take the opportunity to go ahead and teach others. Now what's interesting is tell me more about what you felt in your neck and what your primary care doctor and you had felt before your explant.
Every time I went to the doctor, she would feel my lymph nodes and ask me if I was sick because they were so large.
Where were the lymph nodes? In the neck? Where else?
In my neck primarily is what she felt, but then I could feel them in my breast tissue as well.
Right, in the armpit area, yeah, because that's where exactly all the lymph nodes. Now what's interesting is, as you will see, in the side attachment, you had a mass I removed from the right chest and it looked abnormal. Anytime I dissect and I find anything abnormal, I send it off to pathology. And it was indeed reactive hyperplasia, which was reactive lymphoid tissue. And again, this is reacting to what is the silicone. Because now, as I talk to you, you're 8 days out. Do you notice any masses in your neck?
No, I don't.
Okay.
And it's awesome. And I didn't notice that until you told me what that mass was. And then it just made me think about what my doctor always telling me that. And I feel absolutely no lymph nodes at this point.
Wow, so this was the reactive hyperplasia. Now, we will continue to see, because this is no, basically coincidence, but this is a direct before and after. Because we see clearly the CD30 stain that was done, there was no lymphoma. And this was indeed what is reactive tissue and the fact that you don't feel this. Now, how was, so it is important that your plastic surgeon send the capsule off and any inflamed tissue, any bad tissue, anything abnormal, suspicious to pathology, because if you don't check it, we will miss a lymphoma, we will miss tissues, we will know why you were having these reactive lymph nodes. And if I ever run into anything, be I'm doing a tummy tuck or anything, I will send these off, because if you don't send, the eyes don't see what the mind doesn't know. And I have also, very importantly, my pathologists are looking at and staining exactly what I asked them. Because if you were to send it to another lab, let's say in the middle of a town where they're not doing this routinely, they will not check for the stain and they will likely miss something that they need to rule out, which is the BIA, breast implant associated anaplastic large cell lymphoma. Now, how do you feel overall post-op now, 8 days out from your surgery?
I feel really, really good. My head feels clear. I'm tired because I went through surgery and it's kind of hard to sleep at night sometimes, but overall I feel a lot better than I did before.
Sure, and you had your implants for almost 6 years or so, right?
Yeah.
2015, that's 7 years.
Yep.
Right. Okay. No, thank you very much for sharing your journey. Anything else you want to tell any patients, prospective patients, or young patients who are interested in getting implants?
Definitely don't do it, because this was so much money and effort to undo. But I'm extremely happy I could undo it for my health.
Did you need drains?
No.
All right, absolutely not.
No.
To put drains in would be wrong in you and the many other patients that I've done. The second question, do you think you needed a lift?
No, definitely not.
Yes, and again,
it's very surprising.
Yeah, and this is what I say. I love to operate. If I could, I wish I could be operating 24/7, but don't do any unnecessary surgeries. Less is more in this case, and you get your body chance to heal, recover, and vast majority of the case patients do very well without the lift. And if you ever do need one, let's say the 65-year-old patient, get it a year later just to let your body settle and you have less problems and more defined of a surgery that will last a lot longer without any potential for complications. Thank you very much for allowing us to share, and I will tell you, this is 101. This is the second thing that the FDA has highlighted. Implants are associated with lymphoma, especially the textured ones, but also the smooth ones, and we can see that directly, definitively from you. Now, when you go back to your primary, obviously he will learn and he will see your pathology report and he'll put the 2 and 2 together, and we'll continue to hear from you 6 months out, 3 months out as to how you're doing and how your body has improved over the years.
Yeah, thank you, Dr. Khan.
You're welcome. Thanks.